I am Dr. Pradyut Waghray, senior pulmonologist from Hyderabad in Apollo Hospital, Jubilee Hills, and a professor of pulmonary medicine at SVS Medical College, Mahbubnagar, Telangana, and managing director of the Pune Institute of Medical Specialties, Hyderabad. This is in continuation of my earlier video on COVID-19. Between the last week to 10 days, I have been asked by many of my patients a few doubts and questions about this COVID-19, so I thought that I should clear this in my next video. So COVID-19, as we all know, is caused by the coronavirus, and there is a doubt about people ask that how does this virus transmit. What happens is when a person with this coronavirus infection sneezes or coughs, a lot of droplets, they fall on the surfaces or on the ground. So if you are in a distance of less than 3 feet or 1 meter, and if you happen to inhale those infected droplets, then you're likely to get infected. Number two, if you happen to touch the infected surfaces with these droplets, which can stay on the surfaces ranging from few hours to several, almost 9 hours it seems, and if you happen to touch these droplets and again touch your eyes, nose or face or mouth, and then you are likely to get infected by this virus. The next thing many people they ask is, what happens to a person who develops the disease? So luckily, fortunately, majority of the patients who develop this infection, almost 80 to 85% have a mild infection like any other viral infection, and they recover based on their own immunity and resistance. About less than 20% of patients actually need hospitalization if they become extremely breathless and develops viral associated pneumonias. And out of these, very few patients, especially with associated comorbidities, who are really become very sick and they need to be admitted to the intensive care facilities. There is a doubt that what are the age groups which this virus can affect? Can it occur in children as well? Yes, the virus can affect in all age groups, but in children the infection is generally milder, and in older persons and those who are having pre-existing medical conditions, for example diabetes, hypertension, chronic lung disease or any cardiac issues, they are more likely to develop serious complications of the illness. How long does a coronavirus survive over the surfaces or objects? As I have told earlier, this can happen when these virus droplets fall on the surface. They can survive ranging from a few hours to several days. This depends on the surface where they have actually fallen and the temperature and humidity of the place. Whatever is the criteria, by using a simple disinfectant, it will kill the virus and thereby prevent it from the others getting infected by this infection. What are the common symptoms of this infection? This is like any other viral infection. They can present with fever, sore throat, cold, cough, and shortness of breath. The warning signs in this is shortness of breath. So this patient, how it differs from a normal viral infection? Apart from these symptoms, the classical features of this is extreme myalgia, that is muscle pains and aches, and some people can have diarrhea. Breathlessness is a sign to be concerned, and if any of these symptoms are experienced by a person, especially those coming in contact with a suspected coronavirus case or with a history of travel to a coronavirus affected country, then you should consult a physician. Is there any specific treatment for this virus infection? So far, there is no specific treatment for this virus infection, though a lot of reports, anecdotal reports, and some recent papers are published in countries which are already severely affected by this disease, that hydroxychloroquine, which is a commonly used drug for most of the rheumatic disorders, and chloroquine used for malaria in our country, has been showing some positive results in both as a prophylactic and as a therapeutic drug in this disease. However, please use these drugs after consulting your family physician. So what can we do in the absence of severe, there is no specific treatment? What can we do to protect ourselves and our family members? The golden rules are regularly hand wash. Best is with water and soap for 20 seconds by the regular hand washing technique. If water and soap is not available, then you can go for any of the alcohol based hand rubs. Number 2, maintain at least a distance of 3 feet between you and anyone who is sneezing or coughing. Number 3, avoid touching your eyes, nose and mouth. Most important is stay home. Social distancing. Stay home if you have a fever, cough or any of the symptoms which I mentioned you just now. Stay home, even away from your family, and try to consult a physician as early as you can. Then we have seen many people wearing lot of medical masks. So there has to be some clear guidelines as to who should use medical masks, of course, apart from healthcare worker. Number 1, when a person develops cough or fever and becomes symptomatic, then use a mask because it will prevent the infection from infecting you. You can prevent your infection spreading to others. But don't forget that hand washing is very, very important apart from wearing a mask to prevent the spread of infection to others. Number 2, whenever you are visiting any healthcare facility, either for yourself or to care for any other ill patient, then wear a mask. Number 3, close family contacts of a suspected case or a confirmed case of coronavirus who is taking care of the home care of this patient, they should wear regularly medical masks. Hand sanitizers are again have a lot of importance. This has to be used by alcohol-based hand sanitizers, or as I told you earlier, simply rubbing your water washing your hands with plain water and soap for at least 20 seconds. So this plays a very, very important role in spreading the infection, in preventing the spread of infection. Commonly, people ask me, is there any specific foods or drinks which can actually help in the treatment of this coronavirus infection? Let that be very clear. There is no specific recommendation that particular food helps or worsens this condition. However, the advice is that one should take regular diet with good healthy food like fruits, vegetables, etc. and try to stay healthy. Is there any vaccine available? That's another common question asked. So far trials are on, but as of now no vaccine is readily available for this COVID-19 infection. Certain common myths which people ask is, does this disease spread through eating chicken, eggs and meat? Does it spread through the pets? He said no, it doesn't spread by eating chicken, eggs or meat, and the pets won't transmit the disease. Even somebody asked that, can a person who dies with coronavirus, can he infect others? There is no transmission of coronavirus from a dead body of a person. So then, what can you do to help in containing this disease? The golden rule is personal hygiene, that is hand washing, cough etiquettes, avoid unnecessary travel. Please maintain social distancing. Avoid unnecessary travel, unnecessary participation in public gatherings where it is not required, even social gatherings. Avoid all these things. Maintain good social distancing and quarantine, and this can contribute greatly in breaking the chain of this active transmission. Thank you.